when your child is unwell, especially if your child is a baby, there are some consistent but very subtle signs that you can look for. So by the time your baby is a week or 2 weeks old, you have a good sense of what they're like. What, are they a happy baby, a calm baby? It tends to be a bit more of a fussy baby. And I usually recommend to new parents to just, if anything is out of the norm for you and your baby, you probably want to speak to your doctor. So little ones under the age of 3 months can get real sick real fast because their immune system is still developing. A lot of them haven't had their vaccines yet. And so we keep a very close eye on them. So things that I look for to know that a baby's unwell would be suddenly they're not eating very well, right? So you had a good eater who suddenly is refusing breast or bottle, a baby who is very sleepy, which can be a little bit hard to tease out because newborns sleep a lot. But what I'm talking about is a baby who won't wake up. So if your baby is sleeping 2-3 hours and wakes up by themselves to eat every 2-3 hours, perfect. If they're sleeping 3 to 4 hours and are waking up to eat appropriately, great. But if you have a baby who wakes up every couple hours and all of a sudden it's been 3, 4, 5 hours and you go to try to wake them up and they just don't seem to be able to wake up well, or they wake up a little bit and they kind of fall back to sleep, that might be a sign of concern. It may be normal. They could be going through a growth spurt or just stretching out their sleep. But we would want to see that baby. Fussiness is another thing that can be concerning. Babies cry and they cry a lot, but generally you should be able to calm your baby down. So generally you should be able to have your baby crying and pick them up and you rock them, or you feed them, or you change them, or you do whatever it is that normally would settle them, and then they settle. But if you have a baby who is just crying, and you've done all your normal tricks and they are not calming down, and now you have this baby who's been very fussy for a while, that would be another reason to call your doctor. And then fever. So obviously fever is a sign of infection. It's what our body does when we are sick. In young babies and newborns, we don't want them to have fever. Their immune system isn't unable to really fight off infections. So anything above 100.4 degrees Fahrenheit, which is 38 degrees centigrade, is considered a fever in newborns, and in the US would require further evaluation, maybe a stay in the hospital, maybe antibiotics. So that is what we look for in little babies. Now in bigger kids, the signs of a child being unwell are a lot of the same signs that you would have. So your baby has a cough, or your kid has a cough or runny nose or fever, or they're, not as energetic as normal, not eating as well, all these sort of same signs. In older children, especially if they've already been vaccinated once or, with their different vaccines, while we still are concerned, obviously, if your baby is sick, it's a little bit less of an emergency because they've already had that boost to their immune system. They're older. So their natural immune system has developed more. But those are the signs I would look for, especially in little ones, that would be a cause of concern and maybe require more of a evaluation.